Welcome to the first session of the MDS Women of the Month series. This series is an initiative by Women in Movement Disorder, the special interest group of MDS, to shine light on some of the brilliant leaders in the field of movement disorders and who have contributed and continue to contribute immensely to the field. They'll be sharing their experiences and words of wisdom for other women to get inspiration to pursue this field and become leaders in the field. It is an immense pleasure to welcome Professor Claudia Trenkwalder, a stalwart in the field of movement disorder, as our first guest. Professor Trenkwalder needs no introduction in the movement disorder field, is one of the biggest names in the field of movement disorder. She has been the president of MDS and has a distinguished career as a movement disorder neurologist. Welcome, Dr. Trenkwalder, and thank you for agreeing to give your precious time for this interview. So the first question, we all know you've had a trailblazing career with academic accomplishment and leadership roles that you've taken and completed with acclaim. What would you consider as the major highlights of your career up till now?
First, thank you for inviting me to this recording. And I think it's, as you already mentioned, it's definitely important for other women to advance into leadership for movement disorders, as we really need female leaders here. And coming back to your question, what are the main, highlights of my career? It's definitely the presidency of the Movement Disorder Society, to begin with the last one and the most recent one. But in addition, there were also some other highlights. So from the beginning, I was, after starting with residency in neurology, I started in Munich. I started with movement disorders right away, and Parkinson's, restless leg syndrome. And then after some years, I got appointed as the head of a research group, movement disorders and sleep, in the Max Planck Institute of Psychiatry in Munich. And I would say this was my first highlight. And I could build on a team, a research team for clinical research and sleep and movement disorders at a time when not many movement disorder experts looked into sleep, what has significantly changed with RBD until now. And after this, I continued with clinical movement disorders, restless leg syndrome, polysomnography, and moved on to the University of Göttingen. And then there was another highlight, as I was offered the position of chairing the Paracelsus Elena Clinic, the largest Parkinson and movement disorder hospital, also the most ancient one in Kassel, Germany. And at that point, I was able to build on a large, I would say, area of clinical research, but also of patient research and patient care in Parkinson and movement disorders. And there were several other, let's say, awards, but I think the most interesting always was for me to know other scientists, to know other people, and to have international, but also local collaborations in the work.
Thank you so much. So another question, and I'm sure many people have asked you this question, what has been your experience as a woman navigating this path, especially as a leader, as the best president of MDS? How did you find, what was your experience as a woman?
Yeah, I definitely have been asked this question many times, and it's difficult to answer, as at that time I did not feel a specific problem being a woman. Maybe at the beginning, when I started with my first paper at the University Hospital in Munich, I did a first small research study. I wrote up the paper, and then we discussed with our senior the authorship. And then he told me, oh, maybe you may not need the first authorship because you may not go into research further. So let's do this, your male colleague, because he needs this for his career. And this was some turning point for me, as I thought, oh, I did all the research and he supported me, certainly, but I should be the first author. I insisted on being first author, and they said, okay, if you want to do this, it's okay. And from this time on, I realized that if you want to do your studies, your research, you have to be persistent, and you have to tell people that you are the one who are doing this, and then you are presenting it at conferences, you are writing the papers, you are the first author. And I think this is a lesson that one should learn as a woman. Men do not need to learn it because they know it by heart. But women, they need to be told about that. And I think this is maybe one of the messages I would give them, and what I have experienced. But another experience is that I have often been the only woman in a big round of meetings, consensus meetings, discussion groups. And I remember some time ago being the only woman in a large NIH meeting, the first one on restless leg syndrome. But I have been asked about my opinion, and I gave my opinion. And I can only tell women, be confident and show up, say what you have to say, don't be shy. And that's the only way how to make it.
Thank you. So another question, again, I'm sure people have asked you, but we'll again ask you again, especially because it's women who have to do multitasking. They have to take care of family, they have their professional commitments. So how did you maintain work-life balance? What are the tips that you want to share with others? How to maintain a good work-life balance?
Yeah, work-life balance is also a difficult terminology. I think at the moment you ask this question, maybe something is wrong, because if you always have to differentiate between work and life and find the balance, that's maybe difficult. So I would recommend keep a realistic and well-organized schedule with your family and with your work. And please don't believe anyone who will tell you you can either have a career or a family. This is not true. I have a family, I have 2 kids. I have now, together with my husband, we have 5 grandchildren. We have a big family. We are taking care of them all. And there's still a career.
Yeah.
So this is not, and you always have to ask the question, would this question be addressed to a man? So would you ask a man, do you want to decide either family or career? You would never ask this question to a man. So, but still, women are more responsible within families for taking care about the organization of the family, about the kids, whatever will happen. So keep a well-organized schedule. And I think you have to have the feeling that your kids are well taken care of, but also that they have the feeling that you are an important person for them. You are the mother. So the moment you have the feeling you you cannot do or manage your kids or give them enough love, then you have to change your schedule. So you have to be happy in both parts, in your family and your career. And sometimes it's difficult, and you have, what I did, I took my kids sometimes to the hospital. I showed them what I was doing. I took them with me to a congress. So I remember that my son played tennis with Art Walters in Orlando at some sleep conference, and they remembered it for years. So just that they know you are doing something important, you are working, but you share this with your family and with your kids. And I think this is an important message as well. And you don't have to feel guilty about what you're doing.
Yes, of course. Yeah. One more question again. This is specifically for leadership roles. We see that women definitely are not so, they don't take the initiative to take leadership role. What would be your biggest advice for women, especially in the movement disorder field, who want to take up leadership roles?
I think to take up a leadership role in a society also means that you should take up some leadership role in your own institution. This means that you are in some academic position, or maybe in some important clinical position. For an academic position, the most important for women and for men is to research, but also write up your research. There are many people who are doing nice research, working a lot, but they are not able to write up their research in papers. So this is something you have to learn, and then you have to do it. It's really difficult to start, and it may need some evenings, some weekends. You cannot always do it during your working time, especially if you work in a clinical position and seeing patients. So this needs your willingness to work on an academic career, and then you can also take on a leadership role. In a scientific society, you may not get into a leadership role without a scientific background. I think this is very obvious. And for the science, you need to write up grants, but it's so different from country to country. I think there's no general advice, but the general advice is to be persistent and to focus on specific topics of research and to pursue your topic, your focus, and to look for a mentor. So you need a mentor both for your science, but also, I would say, in a scientific society, you need someone who guides you how you best achieve here some position and some leadership role, but it always starts with work.
Of course. Thank you so much. I'm sure your journey and your achievements, and especially your role as a leader, will inspire all the women who are pursuing movement disorders. Thank you again for your time, and all the best for your future. I'm sure you'll contribute much more, and we'll do a lot of big research work and academic work in the future. Thank you so much for your time.
Thank you, Deepa, for the good questions. And I hope that women will really be successful and become even more successful in the future of MDS.